Hello. Today I'll be talking with you about the database registration of Indiana's vital events drive system. This is the new system for registering birth, death, and fetal death records within Indiana. In the fall of 2020, the birth and death records will move to the drive system from the Indiana death registration system that many currently know as Genesis. That is in the fall of 2020. In the spring of 2021, we'll be moving the fetal death system, the fetal death registration system, into Drive as well. So there are a couple things I want to go over before I move into the Drive system and begin showing you around. The first thing I want to let you know is that when the Drive system comes online, it will only be accessible via the Access Indiana portal. So the Access Indiana portal is an Indiana government portal where you can go into the portal and you can look into multiple government services that are available in Indiana. So you can log into the Access Indiana portal to look into maybe an IPLA, that's Indiana Professional Licensing Association services. You could also log in to see about reserving a campsite at a state park in Indiana. So there are a number of things you can look into and services that you can acquire within the Access Indiana portal. But the Drive site, our registration of birth and death and fetal death records, will move into this Access Indiana site this in the fall of 2020 when the Drive system comes online. The Drive system will be replacing the current IDRS and IBRS or Genesis systems. To get your Access Indiana account, that is an account you will need to set up independent of the Drive system. Since this is Access Indiana is a portal, it is operated by the state of Indiana, not by the Vital Records group within Indiana. So there are directions on how to create your Access Indiana account. You will want to go to in.gov/access, access, ACCESS, or you can just Google search or use whatever search engine you'd like, and look up Access Indiana, and that will take you to the Access Indiana website. So once you create the Access Indiana account for yourself, and here's a step-by-step instructions that you can see for this. But once you have this set up and you log into the Access Indiana account, what you will find is if you search the options, you will find one that says Drive. That is our Drive icon to get into the system. It is not active at the time that I'm recording this training, so I cannot show you that because we have not quite launched our Drive system. But once you log into your Access Indiana account, you will be able to search for Drive, and you will be able to click on that Drive icon. When you click on that Drive icon, the first time you will be presented with a new user request form. It is all electronic. You will complete that one page of new user request and hit the submit button after you put that information in. That submission, that request, will go straight to our Vital Records department at the Indiana Department of Health. We will review the request, verify your credentials, and we will give you permission to access our Drive site. You will receive an email notification saying that you have been given access or that you've been denied, and the reason why you've been denied if you have been denied. And if you have been granted access, the next time you log into the Access Indiana portal and click on that Drive icon, you will be taken immediately into the Drive system. And I'm going to go ahead and log into the Drive system so you can see the page that you will be presented with when you first go into the Drive system. So you will see I am putting in a username and password into the Drive login page. You will not have this login page. The login information that you will use will be the email and the email address and password that you set up on your Access Indiana account. You will not be required to set up a separate email or separate username and password to log into Drive. We will be linking your Access Indiana login to your Drive account. So as long as we give you permission to log into, to enter into the Drive system, it will be a one-click entry into Drive once you've gone into your Access Indiana portal. So this is the home page for the Drive system. I'm going to step you through this real quick before we go into the records, just so you know how to navigate the system itself. So the system is 100% web-based. You can use any web of the major web browsers that you'd like. They all work with this system. We've also tested it on Macs, Android-based items such as, so even a smartphone you can use. Once you get into entering information into records, it may not be the most enjoyable to use a smartphone, but you certainly can do. Or if you want to just retrieve information from a record, you can certainly do that on the smartphone with no problem. We can also use desktop, laptop, and tablets with this system. As long as you have a web browser and access to the internet via Wi-Fi or a landline, then you will be able to do this. So here is, to let you know how the site is set up. This is the facility you're associated with. You will be able to associate yourself with multiple facilities if needed. And to move around facilities, if you have multiple facilities, all you would have to do is click log out. And it will actually take you back into the main Access Indiana portal page, where you will then click the Drive icon again. And when you click that Drive icon, if you have multiple facilities, the first thing it's going to do is present you with a list of your facilities. And then you click which facility you want. So that is how you will navigate between facilities. You will not be required to re-enter a password or a username or an email address, but you will be using this logout, and then you have to re-click on the Drive icon so that you can be presented with your different facilities. If you only have one facility, you'll just come in here. You'll see your facility here. You'll see your username here. This username will not generally be something that you need to remember or use, but it is here as part of the system and the way that it is presented. Down here, you'll have what's called fast links. Fast links are items that you use frequently. The system will recognize the items that you use often, and it will present them down here so you can quickly click them and go into that section that you frequently visit. You also have your queues here, so you can see your registration work queues and your amendment work queues, things for you to work on your different records that may be either in some level of registration, or maybe you've submitted an amendment. Over here, we have a number of items at the top with drop downs. So the first one is main, and you have a home. The home pages is the one that we're on right now. The second one is user profile. I do want to show you one thing, and that is the security, password and security questions. So this will not be used in this Drive system. And the reason why this is not going to be used is because your password and security questions are all going to be from Access Indiana portal, not the Drive system. We'll go back to the home page, and then we have messages. Messages this is something new to this system. So those of you who are using today's death registration system, you will have not had this. So this new system, Drive, will have the ability to do the external emails that you received today, where when your name is added to a record and you're asked to complete the medical certification, you will receive an email to your external email, whether it's, for this, it would be Adams County Coroner email address or whatever email address you've stated to have associated with your user profile. So I will tell you that you will only have one email address that will be that external email address that will be associated with your user profile. The other way that you're going to receive information is the internal messaging. This is probably going to be most useful for your coroner staff, who can come in here into their user, their own staff user, and they can see all of the requests for certification for all of the coroners and deputy coroners that are within that coroner's office. So you can see here that I have a number of different messages that I've received from different people who have sent things to me. Or here I'm coroner 7. Here coroner 10 has done a certification on this record here. So it also tells me when a case is or a record has been certified within my facility. It's also here you can see coroner 7. That's me. I accepted a referral for this record here, and so it will give you all of the information on what's going on with all the records within your facility. In this case, your coroner's office. And we'll come back to this because I'm going to go into this record here that I was just referred to. It was just referred to me as the coroner. So the next thing that we can do here, we'll go back to the home page. And we'll go in here to the death or the life events, and we have death and fetal death. The fetal death system, as I mentioned, is not coming online until 2021. So it is not until March, April of 2021 that the fetal death will be accessible. But we will go into the death. That is what I want to show you today. You'll have the option to locate case, and that is the looking up cases that are already assigned to your facility or your coroner's office. So this will be for records that are unfinished as well as ones that have already been finished. So if you have a record that you already certified and it's been registered, you can look it up here and you'll be able to access that record. For an amendment, or if you need to print a working copy of the print form of the death record, you can do that. Even after it's been registered, you will have access to do that printing. The next item that you have here is to start edit new case. So you can start a new case if you'd like. It does do the duplicate check that some of you would be aware of if you use our current death registration system in Indiana. And the duplicate check is just to verify that there isn't already an existing record for this decedent that you're wanting to start a record on. So it'll just do a quick search. You will notice anything that has the red rim and the red triangle are required fields. You'll notice this throughout the system that we use. This system is set up to be ADA compliant. So what you'll find is that there'll be a color and a shape that is associated with different things. Primarily with a lot of the fields, it will be that they are required fields. You must enter something in there. It will tell you if you did not fill out all the fields, and it will tell you you need to complete those fields. So if I put a few things there, hit search, it tells me I need to add the date of death and the sex because I did not fill out the required fields. So that is death locate case and the start edit new case. The next item we have here, we have our cues, just like we had them on the home page where we had them as quick links where you could just click them. We have them here. You'll notice there's a registration work queue and a registration work queue summary. So I'll show you quickly what the differences on that is. The work queue here, you just go to that, it's a drop down. So you can look at the cues and then you can search, you have search filters here that you can use if you'd like to use that. But you can certainly just say, I'm going to go to something where the coroner review required. So that's my list. Or if I go into registration work queue summary, it gives me a different presentation of the possible queues to go into. And here you can see the queue name, the type of queue, the number of records that are in that queue, and then the age of the oldest record in that queue. And then the amendments work the same way. And if you don't have anything in the queue, then the queue, you won't see anything. So you wouldn't see either of these queue options because there's nothing in the queue. Right now we have quite a few in here. We've been playing in the system, learning the system ourselves. So here we have reports. We have death reports. So we can do a report, any of these different reports. So if you want to look up the ones that are pending cause of death, you can click on that. Again, you see the red rim with the red triangle. So you have to put those dates in. It needs to know the dates that you have on here. And these would be the dates of the event. So the date of death and then the location of death. If you want to put a county, you can, especially since I'm Adams County, I'd probably put Adams County here. And then I can load, of course, I'd have to put my dates in here, and then I can do my load report and also make it as an Excel worksheet too. And then I can use that to make sure I have all my records completed. Forms, we do have a print forms. Now, there's nothing loaded here right at the moment, but this would be where you would find blank print forms. So maybe a blank version of a BTP, a blank version of a PNOD, provisional notification of death. That's what we would keep here. Cremation certificates, those print forms could be held here. They would be blank, so you would just print them off, and then you would have to complete them by hand. Help, there are only a few things here in the help right now. The one would be the show the tooltips, which would be when you hover over certain fields, it would help give you a tip on how to complete it, what they're asking for. You do have options to change your theme. So the theme is, so that since this is ADA compliant, you do not have the option to change the font or the coloring. But what you can do is, there are a couple options. So right now this is a modern theme, but we can go to the traditional theme. And this is a traditional theme if you prefer that. The other option is we do have the high contrast option. Right now it's not on, but now it is. You can see a little bit of difference there. So I'm going to go ahead and go into the record to show you, start showing you around. The first thing I'm going to do is I'm going to go into my messages, and I'm going to go to this one that I have had referred to me. So now this was referred from Death Certifier 7. So this is a record that another physician, Death Certifier, has gone ahead and referred to me, thinking that maybe I should be the one that does this record. Maybe they think it's an accident or just something that needs to be reviewed to determine if it is truly a coroner's case or the physician should go ahead and do it. So you see here, I can actually flip through the medical certification and I can look through the personal information and look at everything. However, I am unable to do any sort of changes here. And that is because I have not, I can review it, but I have not decided if I'm going to accept the case or not. So to be able to modify this case, and in general, whether I want to accept it or reject it, what I need to do is, of course, review first, and then I'm going to go to coroner review case. Here, I need to say if I'm going to accept it, decline it, or if maybe I need a little more time to decide. So I'm going to go ahead and say I'm going to accept this case, and I will have to put in, because you see here the little red triangle, I need to put in a case number. So I'm going to go ahead and assign it case number 123. What happens here is the physician who requested me to review this receives an email or a message, both internally and externally, saying that I've accepted this. So now they are no longer going to be the ones on this record, and it's going to be my name. So my name has now been put here as Coroner 7 because I have accepted this. And now I can go through, I can review these pages, and I can make changes as needed. And you notice now everything's open for me to make any changes that I need. So let's say I decide this was an accident. And I'm going to go ahead and say it was an accident, was the manner of death. You notice now I have an injury page that appears. So I would need to complete the injury page. And I'm going to, so that is how this would work with the referral to me. Now, there are times where it would be referred from a from just the funeral home would refer it straight to me, or the funeral home would just start the record and then put my go ahead and refer it to the coroner, knowing that I needed to go ahead and be the one to complete it. And the same thing would happen. I would go down here, I'd do the review of the case and accept it, and then I would start going through each page. I'm going to show you the easiest way to navigate the pages. So I'm just going to start with the medical certification portion because that is what you as a coroner will most often be completing. So I'll start here in the pronouncement. For the medical certification, everything under here is under the medical certifier to complete. That would be used the coroner or a physician. Now, I will tell you that the pronouncement page here and the place of death page are both pages where the funeral home could also enter in the information. So if the funeral home were to start this record, they could put in the information for the pronouncement and place of death and put you as ask you to complete the medical certification. And when you enter it in the record, the pronouncement and place of death would already be completed because they have already added it. At that, you will need to review it and verify that you agree with it. Because it does get certified by you that that pronouncement page and place of death page are accurate. So I'm going to go ahead and I'm going to go into a clean record that has not had someone already entering information here, and I'm going to show you how to navigate through the medical certification to the point that you certify the record. So that one was how you would do the handle the refer to coroner when a medical physician or another death medical certifier were to refer a record to you that maybe they had partially completed. So you would go in, you'd fill the information, and you would need to certify it. Actually, I'm going to go ahead and certify that. That one was almost done. Let's just go back and we'll certify that. We'll go back in here. So the only thing I had changed was I put that the manner of death was an accident, and it wanted me to do an injury page because it was something other than natural. So I've worked through my pages up into the injury and everything was completed. So what I need to do is I'm going to go ahead and hit validate page. So validate page is going to run an error check on all pages of this record from start to finish. So if you look here, the only thing I need to be worried about, because the only areas I am going to medical certify is this. So these are the only pages I'm worried about. The disposition has a yellow circle, which means it needs reviewed, but that is for the funeral home. What I need to be worried about are what I see next to my pages. So I have a couple things. The first is I see the red X, and that means there's something wrong on there to the point where I need to fix that. It will not let me certify this record until I fix that. So here I go on to this, to the pronouncement page, and it tells me that in red, which field is the problem. And here it tells me what the problem is on the error message. So the problem here is it's saying that I'm late in filing this record. This was a July 30th death. And this is now, when I'm recording this, late September. So this is definitely late filing. So what I can do is, of course, if that date's inaccurate, then I just correct the date. But the other thing that I could do here was, if I'm filing a record date, if I'm certifying a record late, then I just go into the comments, do late filing reason, and maybe I'm going to say, this record was just referred to me. And I'll hit save. I'll close that. And now this is actually going to go away. You'll notice that there's now a check mark next to the comment saying that I've added a comment to it. And if I hit validate on this page, you'll notice that that goes away. Both the error down here along with the red up here. I now have a green check mark on my pronouncement page. So I'm going to go ahead and I'm going to work my way all the way down here to my next page that does not have a green check mark. and that's my injury page. It has a yellow circle, and that yellow just means I need to look at something and say if it's accurate or not. So I have a couple options to navigate. I could, of course, just go over here and click. That works. Now, if I had something on this page that it wasn't saved, and I tried to click over here to go to the next page, it would actually give me a pop-up that would say, "Are you sure you want to leave this page because you've changed something?" So there, I just changed something, and if I go over here and do this, see, changes you made may not be saved. So I'm going to cancel that. And I'm going to actually put that back on actual. So my options there would be I can hit save, and then I can go over here and move around to whatever page I'd like. But really, the easiest way to navigate through these pages would be to hit next after you complete a page. Next is going to save everything you've just done, and then it's going to propel you to the next page. So here we go to the next page. So this was referred to me from an individual or from a physician who worked at Adams Memorial Hospital. And so they have the place of death as being in the hospital. So I'm going to agree with that. Go ahead and go through. And then, of course, the cause of death here is this. But earlier you notice I had put that as a manner of death was an accident. So I'm just going to do so they fell down the stairs at the hospital. And so now I'm going to actually validate the page while I'm on here, because we do have some extra error checks that are done on the cause of death statement, and see what this comes up with. So there's also a link here that you can use, and it gives the NCHS, which is CDC's recommendations for entry on cause of death, to offer some guidance. These are some good tips on how to write a good cause of death statement. So while I was showing you that, this went ahead and did the check. So it did not come up with errors as far as cancer that doesn't have doesn't state what type of cancer, nor does it have any spell check errors. Now, those are things that it will pick up, and then you will have to respond to those. And sometimes there'll be things that they'll put in the red, which red means you have to fix it. Or other times it'll just be in yellow, and they're just things that you would need to review. So if also, while I'm here, if I were to start to put something, maybe I put that the person had asthma. And then I realized after a second, before I've navigated away from this page, that's not right. There's no reason to have asthma and the significant other significant conditions, because it's really not related to what happened. This was an accident. So I can hit clear, and it will clear the things that I have not saved on the record. So anything I've just entered, it will go ahead and clear it out. So I've done that. I'm going to go ahead and go next. And here's my other factors. And remember, I did change this to manner of death to an accident early on, because even though this happened in a hospital, I realized, and it was, the physician did refer to me, realizing that it looked like an accident because they fell down the stairs. And so I reviewed it and I changed the manner of death accident. Now, the other item here that it picked up on when I hit the validate page to check for potential errors on the record was it noticed on the injury page, it gave me a yellow circle. And those are items that I need to review and decide if they need to be fixed or not. So I'm going to come to this page and actually hit the validate page to show you what it's picking up on and what it's saying the problems are. So here it's saying yellow for all of these things. And that is because I said it was an injury, it's saying, it was an accident, there was an injury that occurred. So I need to put information on all of these. So I'm going to put a handful of things here just to fill it out. And I'm going to show you this because this is going to help me as well in determining how to write this location of injury. When you see that house, next to locations, it's actually going to give you drop-down lists, so you can begin to work your way down. So I can pick the state, the country, the state, the county, and here I can pick the city. I'm really not sure. Let's go there. I'll just pick burn. That's a good place for it. And describe how the injury occurred. Fall downstairs. And I'll leave it as that. That's not enough information typically, but for the purpose of this, we're going to say it is. And this is going to happen on the injury date's the same date as the date of death, because if you remember on my cause of death statements, I did not have very long on my intervals of death. So now that I've done that, I'm going to go ahead and save this. I'm going to hit validate again. And actually, when you hit validate page, that will save everything that's on there, and then it will do the validations. So here you can see I still have these errors here. It says that the date and time of injury cannot be after the date and time of death. So I have a couple options here. So I can do this go to field here, and all it does is take me up to this red field that's been that's the no-no, right? It's the I have to change this because it's not accurate. Or I can do pop-up. So if I do pop-up, if there are errors that are across multiple pages, what it will actually do is present to me the problems. Oh, look at that. I was just off. Time of injury, 2:02 a.m. Time of death is 2 a.m. So let's do 1, and I think I did 10 minutes. 1:50 a.m. is the time of injury, and then we have our time of death as 2 a.m. All right, so we just did that. Let's try to do the validate page again and see if I can get that error to go away. There we go. So I have my injury page is now a green checkbox or check mark. All of my pages are green check marks, so I am good to go. So you can see here that I now have a new page available for me to navigate to. So I'm going to go to that. That is my certify page. So here I'll need to do my certification. So with the certification, I actually will have on the medical certifiers, so that's coroners and physicians, you'll be required to do a dual authentication. So to certify a record, and this is only for the first record you do for each login. So if you have 10 records you need to certify, you log in one time, you do the dual authentication for one record, and then the others, all you'll have to do is click the certify and hit affirm. But for your very first one, each time you log in to certify the records, you'll have to do a dual authentication. So what I'm going to have it do is send a code to my email address that's associated with my user profile. And then it usually takes only anywhere from 10 seconds to a couple minutes to receive the code in your email, and then you'll put that in here. So the email address that you have associated with your user profile needs to be an email that's readily accessible to you when you're going in and doing certifications of records for this. So I'm going to go ahead and I will have to go get my code. So give me just a moment to log into my email and get that information. All right, and my code is, I will verify my code, and you'll see now I'm authenticated. So I'm going to go ahead and click, I certify that death occurred at the time, date, and place indicated, affirm it. And now the record is certified, medically certified from me. And you can see that if you read the status bar up at the top here, what we have, first we have the death record number. So we'll call it a case ID here. Once it's registered with the state, that information will be right here. Then we'll have a decedent name, first and last name, the decedent, the date of death here, And then here we'll see personal invalid, and that means that the personal information is not valid. There's an issue, and there is on the disposition page. There's something that the funeral home needs to review. Medical is valid. You are good. Everything's green check marked. Or if you had a yellow circle, you've checked it and said that's okay. You meant to have that on there. You have not registered this record yet because it's not completely done. So the funeral home has signed this. The medical certifier, you in this case, has certified it. The personal is pending because, as I said, there is an issue with that disposition date. And then the local registration approval is required. So it has not been reviewed and approved by the local registrar yet, your local health department. So I'm going to go ahead and navigate to another page to show you that if you were to realize that you made a mistake or you had an update that you needed to make on this record before it got registered or it was assigned the state, local, and state file number, then all you'd have to do is go back to certify, hit uncertify. Yes, I want to uncertify it. And you can do what you need to do here, make any corrections you need to do. And then once you make those corrections, so say here, I'm going to say tobacco probably contributed to the death. It didn't in this case, but we're going to put that there. And so we're going to hit next, just because that saves and it saves the page and takes me to the next page. I'm going to hit validate page again. And so I want to do that validate again so that it does the check of everything on the page because I've made a change. And then it will give me that certified link again, that certified. Now notice how I mentioned that you only have to do the dual authentication one time. So here you go. All I have to do is checkbox that. It still has me authenticated because I've still logged in. I never logged out of my account. And I'll affirm it again. So I do want to show you a couple of the other items that are here on the other links. So the first one is print forms. So if I go into print forms, you'll notice a handful of items here. So a few of these are the death transcript, facts of death verification. Those are ones that you can use to to verify that with the family the information for the death certificate. The PNOD, provisional notification of death, and the BTP, we are on here, but we are still, as of 2020, we are still using the paper forms that you're using today from your local health department. So these are on here just as notification for the moment. In the future, if there's ever a change and we go electronic, we have the forms there. But so you can actually click on them, and what these forms here do, the ones from this print forms, because it's in the record, what these are all set up to do is to actually autofill information from the death record onto the print form. So if I open up here, this is the working copy. And I mentioned earlier that you can retrieve records that you've already registered. So they've been registered at the state, they've been assigned a state file number, and you can still go into them. And when you go into them, you'll still be able to retrieve this print form of the working copy of the death record. And you can print it off after it's been registered. You can print it off before it's been registered. Your choice. I know that is one item that you cannot do today, so I want to make sure I make that very clear. You can do that. So some of the other items you have here. So let's go ahead and uncertify, and say maybe you're filling out this information and you're not sure if it really goes to you. So you do have the option to relinquish the case, which means your name will be pulled off of the record entirely, and you won't be able to access the case afterwards. And all you'd have to do is hit OK here. We are not going to do that. We're going to cancel that. But that would be one way to remove your name from the case. Another option would be the request non-affiliated certification. Request non-affiliated certification will be when you need to have the medical certification handled by the local health medical officer. It happens at times. In my time working with vital records, I have certainly seen it a handful of times. So that is an option. So to do that, we just hit the request non-affiliated certification. Because let's see, we're in Adams County Coroner, you would be referring it to the Adams County Local Health Officer. So how you'll use these lookups. So when you go into here, do request non-affiliated certification, you're going to use these lookups. So this is an eraser, so that would be clear. So if you accidentally put in the wrong person, you can hit clear and it would erase it. You also have clear down here, so you can use it in either place. But so I need to look it up. I'm going to use this magnifying glass to look up who I need. So I'm looking for a facility or office name. So I'm going to go Adams, because this is Adams County. And you can actually use the percentage sign here as a wild card, and that will help you to search. If you don't want to write everything out, or maybe you aren't quite sure of the exact spelling, so you can put what you do know, and you can put the percentage sign. You can actually in-cap the percentage signs too. If you, like, I have had one where it was, maybe I thought it was something in Bloomington. You don't have that here. We're looking up Adams County Health Department, but you could do that and do a lookup. So I've certainly seen that one become a way you'd want to look something up. But here we would just want to do the Adams County Health Department. So I'm going to go ahead and choose that. And then I'm going to do my certifier. So I'm actually going to put this to go to, oh, that's not what I want. Bet I can just do that. And yep, so there we go. Here's my Adams Local Health Officer. So I'm going to do that. And now that I have that information there, I can go ahead and hit save. And it's going to send the medical certification request to the Adams County Local Health Medical Officer so that they can review it. And just like you had the refer to coroner and you did a review and you accepted or rejected, that non-affiliated certifier local health medical officer will do the same thing. I'm not going to hit save. I do not want to actually do that. So I'm going to hit clear and to get that taken off. The other option you have here is transfer case. So right now you have this case is under Adams County Coroner. You could do a transfer medical ownership here, and then you just use the lookup here to go to put in whoever you need it. So maybe you don't want this record because you know it actually belongs to someone else, or well, for this it'd be another facility. So you can just put in that facility. Again, you can use the wild card to look up things if you need to. Pick the place you need. There's a couple of funeral homes in there, but that's not where that. But we could go to maybe the Advanced Healthcare Associates is where this needs to go, and I could click that, and I could hit save again. And message would go to the facility and all the individuals who are in Advanced Care Healthcare Associates to complete this record. And if they accepted it and started doing it, then it would be out of your hands. They, of course, would do that. So again, I'm not going to do that. So in trade calls, if you, yes, I am going to leave that page because I am okay with losing my information because I did not want to transfer my case. So here, trade calls, this is not a field that you would be filling out as a medical certifier, but I did want to bring your attention to this. Trade calls, we actually have a separate page for when there's a secondary funeral home that's been added to the record. The funeral home would be adding this, but certainly if you need to be in communications with funeral homes, you might need to know that this is there so you know that these people would also be the people you could be contacting, not just the initial funeral home that was on the disposition page here. And you can also see that the funeral home that would be noted down on the trade calls would also pop up here, just their name, but they would appear on the disposition page as well. So I do want to show you a couple other things before we wrap up. So the first one, So the one thing that I want to show you is this start, edit, new case. So there are times where you may be doing your own record. If for some reason there's not, maybe there's a funeral home associated or maybe not, but you will be, especially when you have situations where you're shipping a body off or something, where you actually will be completing the entire record. That does happen, so we are going to go ahead and cover how that's going to happen. Oh, that's one I already have. I'm going to go ahead and say start new case anyway. So here's the fresh record. I've just started. Now, so the coroner can actually complete both the personal and medical information. All you will need to do is go to the decedent page and hit, is coroner going to complete both personal and medical information? Say yes. And now you are the owner of both the personal and the medical certification of this record. You can still add a funeral home on the disposition page, but the funeral home will not be the one who's actually doing the signing of the record. And from this, you would just go through and you would complete the entire record, all the fields on the record. You would have to sign the top part, and you'd have to certify the bottom part, and you would have to do the validate page for each section and make sure that they had reached either green check marks or that they had the yellow circles that you've reviewed and approved any of the items that it says you need to verify. So that's how that would work if you need to do the whole record. And you can have a funeral home on there. They're just not actually they're not signing the personal information. They're just on the record as being a funeral home that's maybe assisted with the actual disposition of the body or moving of the body, preparation of the body, I should say. Probably more likely. So the other item I want to show you is, let me look up this one, is one more record. And this is one where a funeral home has requested me to complete and certify a record. So they've done the refer to coroner. And there's a very particular one that I had on here that I was looking at. Oh, it's this one right here. That first test I had. So this is one where the funeral home has already started the record, has entered very little information in it, but has already started the record. So you can see on the disposition page, there's already a funeral director and a funeral home associated with this record. They had referred it to me, and up here you can see it says referred to coroner, coroner review required. So now I know I need to go down here. There's nothing on here because this is a fresh record. I'm going to go to coroner review case, and I'm going to go ahead and accept it. It's a new case. Maybe I was expecting this. And I'm going to go 1, 2, 3, 5. My previous one was 1, 2, 3, 4. I'm going to go ahead and save this. Now the funeral home will get a notification that I've accepted the referral of this record. And so now I will just go through and I will complete the record. One other item I do want to show you is that on every deceased page on the death records is we've actually added the sex and a gender field. So the gender is so that we can accommodate those who have had a sex change or some sort of a gender reassignment. So we will be able to do that. So you as the medical certifier and the funeral home will be able to modify this page up in this gender and section gender fields up until the time that the funeral home certifies their portion of the record. As soon as the funeral home signs their area, these become locked and you can't edit them. But initially you will have that as a medical certifier, you will have the option to go ahead and put this as you know it to be off of their sex and gender. So another item that you can also do, if you were in a case where you had a funeral home and you wanted them to be the ones to complete the personal section, but for whatever reason, you were the one who actually started the record. Maybe you had started it before the funeral home was decided, and so you went ahead and got it going so that you could have it ready, and then the funeral home was decided by the family. So in those cases, you will actually be able to do here's where I've just started a new record, right? As my funeral home, you will actually have this option to request a funeral home. Now, as soon as the funeral home is already on the record, you won't have that choice. So that's the reason why I went ahead and created a new record, so I can show you have a request for funeral home. And this works much like the other ones that I've shown you where you request non-affiliated certification. Is you would just go here, you would put in the funeral director name, and then in a search. And again, the percentage signs are your friends, they're your wild card. And you'll do the same, so your funeral director and the facility they're at. And then you'll hit save. They will receive a notification that they've been requested to be the funeral home for the record. And you will receive a notification when they've actually taken that on, that request has gone through and they've begun entering the information. A few things about this I want to let you know is that just that you as the medical certifier and the funeral home can both work in the record at the same time. You do not have to wait for the funeral home to finish their portion before you can put in your information. You can actually do your certification prior to them finishing their portion. And once both parts are done, then it goes to the local health department for review and approval. So you are in no way bound by the funeral home completing their part before you complete yours. The only exceptions I would say with that is if you need the funeral home to answer the pronouncement in place of death portion, then you would not be able to do your medical certification until those 2 pages were completed. So one of the other items here that I wanted to go over with very quickly for the sake of everyone's time here will be the amendments. So I'm going to go ahead and pull up a record. Just a moment here. All right, so I found a record. So I'm going to go ahead and go over here, and it's actually in my messages because, as I mentioned, the messages will tell you different things that have happened to the record. So one of them is it will tell me when a registration has been registered. So I'm going to go to Ned Smith. And I need to make an amendment on this. So I'm going to go ahead and go. So one thing I want to show you first, let's go back for a second, is what you'll notice here is that there are different options down here on the other links. So instead of refer or transfer, my options are now to create amendment, to do print forms. So as I mentioned before, you'll still have that working copy option available to you. So I can open it up and it will allow me to go ahead and open this up, this working copy, and print it. And this is a registered record. This is registered at the state, and I can still do that. And there's a check mark there, so I know there's something there. So I'm going to go to amendments, though, because I want to do an amendment. And so maybe I want to do, I have 2 options here, administrative error on the death, or if I need to do a medical amendment. And of course, I think we all can figure out for coroners, especially doing a medical amendment would be maybe an update to a cause of death statement or something of that sort. So I'm going to say update cause of death. I'm going to save that. And it's going to give me a handful of pages I can amend. These are the ones that are my options. So I'm going to do cause of death amendment. Oh, look at that. So blunt force trauma to the head, fall from ladder, COPD, and heart attack. That's a lot. I'm going to say COPD, maybe that was determined to not be part of it. And so I'm going to move up heart attack as well. And I'm going to say, well, we'll go immediate. So this was an accident, but there was a heart attack in there that initiated it. So we'll go with that. So now I have options down here. Of course, I can hit clear, which will clear the changes I just made. I can hit save to save what I've made, the changes I've made on here. I can also validate the page or validate the amendment, and that's going to do that error checking. And then I can cancel it. Say I get through it and decide, oh yeah, I was wrong, I don't need that. I could always cancel it. And you can see even up at this point, I have the option to cancel it. So these are the changes it tells me. Items as it appears right now, items as it should be. Of course, I can edit and delete these if I need to. I could also throw in other pages if I have other things I need to amend. If there are a lot of changes on multiple pages, I can do that all in this amendment. So one thing I do have to do to submit this amendment to the state to do a review, or just to so that they know that you have reviewed it and you are saying that this is a true amendment, this is exactly what you want to say, is we need you to just affirm it. So you're actually you'll see this red up here saying you need to affirm. You'll go to amendment affirmation, and all you're doing is certifying again. You don't have to do a dual authentication at this for amendments, but it's just asking that you go ahead and certify again that this is, to the best of your knowledge, the information that should be on this death certificate, and affirm it. And that's how that one will happen. Now here, you can see it now says amendment exists. So you have that there is an amendment on this record. So that is how that amendment process works. Pretty straightforward and simple. Again, all you do is under other links, it has to be a registered record, of course, and then you'll go to amendments and you'll start your amendment by choosing your type, save, and it will give you the pages that you can amend. So this is the end of the training. I covered quite a bit of information. I hope it was very helpful for you in learning the system. And if you need to watch this again, of course, it is an on-demand training that's available for your viewing whenever you need to. So I hope this was helpful for you. And I hope you enjoy working within the new drive system in the state of Indiana. It should be very exciting for everyone to begin using this new system. Thank you for joining me. Have a good day. Bye.